People often underestimate how quietly poor circulation can affect their bodies, slowly stealing strength, balance, and independence without any warning signs. In my clinical experience, I've treated countless patients who initially came in with complaints that seemed minor: heavy legs, cold feet, swelling, or occasional cramps, only to discover that their circulation had been declining steadily for years. The most shocking part is how silent this process can be. By the time physical symptoms become noticeable, the arteries and smaller blood vessels have often already suffered significant stress, leaving patients vulnerable to weakness, numbness, and fatigue. What most seniors don't realize is that simply walking, which is commonly recommended for leg health, does not fully stimulate the deep vascular channels responsible for delivering oxygen and nutrients to the muscles. When circulation begins to fail, the arteries become less responsive, pressure diminishes, and the smallest vessels shut down first. This is why tingling, numbness, and heaviness in the legs often precede more serious complications. The breakthrough discovery. In our research lab, we found something remarkable. Targeted exercises that intentionally engage and force circulation deeper into the legs can produce measurable improvements in blood flow within minutes. Swelling reduces within days, and patients who once struggled to lift their feet regain stability and confidence in their steps. Using advanced sensors to track blood flow, the changes were so significant that multiple tests had to be repeated to confirm the results. These exercises don't just benefit leg muscles, they influence overall vascular health, helping arteries remain responsive and small vessels reopen. The goal of this guide is to introduce 5 scientifically supported, surgeon-approved exercises specifically designed to enhance circulation for individuals over 60. Each exercise is carefully structured to maximize blood flow, stimulate oxygen delivery, reduce swelling, and restore strength while remaining safe and joint-friendly. Exercise number 5. Standing heel raises with progressive. Hold. The first exercise may appear deceptively simple, but is incredibly effective when performed with precision. Standing heel raises with a progressive hold technique activates circulation throughout the lower legs in a way that walking alone cannot. Your calf muscles act as a secondary heart for your legs, a mechanism known as the calf muscle pump. Every contraction pushes blood upward against gravity, helping keep the veins and arteries active. To perform this exercise correctly, stand with your feet hip-width apart, distributing your weight evenly. Slowly rise onto your toes while counting to 3, then hold at the top for 2 full seconds, squeezing your calves intentionally as if compressing a soft object. Lower your heels over 3 seconds, maintaining tension throughout to keep the blood moving. Gradually increase the hold at the top by 1 second each week until reaching 10 seconds. This progressive technique encourages the growth of new capillaries, creating additional pathways for blood flow. Begin with 3 sets of 15 repetitions twice daily. Once in the morning to stimulate circulation after lying down overnight, and once in the evening to counteract pooling from daily sitting or standing. Many patients notice a warming, tingling sensation in their legs within minutes, evidence that oxygenated blood is reaching previously stagnant areas. For added benefit, try performing the exercise barefoot on a slightly elevated surface to engage even more muscle fibers. Exercise. Number 4. Seated leg extensions with ankle flexion. While leg extensions are often associated with muscle building, combining them with ankle flexion creates a powerful circulation boosting effect. This exercise targets the tibialis anterior along the shin while addressing venous stasis, the tendency for blood to pool in the lower legs during prolonged sitting, a common issue for people over 60. To perform, sit in a sturdy chair with your back straight, feet flat. Extend one leg fully in front of you while pulling your toes toward your shin in dorsiflexion, holding the position for 3 seconds. Imagine pushing against an invisible wall with your heel to create resistance. Lower slowly over 4 seconds, maintaining ankle flexion to sustain blood pressure and prevent backflow. Perform 10 repetitions on each leg consecutively, then repeat the circuit 4 times. This continuous pumping action can increase blood flow velocity by more than 50% based on Doppler ultrasound studies. Because it is performed seated, the exercise places zero stress on the knees or hips, making it ideal for those with arthritis or previous injuries. Advanced practitioners can add resistance bands or ankle weights to increase muscle activation and circulation further. Many patients report visible improvements in foot warmth and reduction in swelling within just 1 week of consistent practice. Exercise number 3, wall sit with calf pulse technique. The wall sit with calf pulses combines isometric contraction with rhythmic calf pumping to create a profusion pressure gradient, enhancing circulation through even the tiniest capillaries. Isometric exercises, where muscles contract without joint movement, have been shown to improve blood flow and lower blood pressure in older adults. Begin by standing against a wall, walking your feet forward about 2 feet, and sliding down until your thighs are parallel to the floor, creating a 90-degree angle at the knees. Ensure your knees are directly above your ankles. Once in position, perform rapid calf raises, pulsing at roughly 2 pulses per second. This combination forces blood through the legs in waves, reaching areas that may have been oxygen deprived for years. Start with 20-second holds, gradually working up to 60 seconds. Focus on deep, controlled breathing to maximize oxygen delivery. For those needing modifications, sliding down only halfway or placing a stability ball between the back and the wall provides support without sacrificing benefits. After each set, shaking out your legs allows fresh blood to flow in. Regular practice not only improves circulation, but can reduce leg cramps and enhance muscle endurance. Exercise number 2, supine leg cycling with resistance intervals. The supine leg cycling exercise is highly effective for restoring circulation in dormant areas of the legs. By lying on your back with legs elevated, you reduce the effort required to overcome gravity, allowing blood to flow more freely. Pedaling in the air simulates cycling while engaging multiple muscles, creating a dynamic pumping action. The key is alternating between 30 seconds of slow, controlled pedaling, imagining movement through resistance like thick honey, and 15 seconds of fast pedaling, focusing on rapid, powerful rotations. This interval pattern produces pressure waves that maximize blood flow, promote nitric oxide release, and dilate blood vessels. Begin with 3 to 5 minutes, gradually increasing duration as strength improves. Benefits include reduced swelling, improved oxygenation, and relief from discomfort or stiffness. Because the exercise is performed lying down, it places no strain on knees or hips, making it accessible to those with joint issues. Advanced variations with ankle weights or resistance bands further enhance blood flow and muscle engagement. Patients often report feeling energized and lighter in their legs immediately after completing a session. Exercise number 1, walking backward with toe touch intervals. The walking backward protocol with toe touches is the most powerful circulation exercise of all. Backward walking engages muscles in a unique sequence, activating calves, hamstrings, and glutes in patterns that stimulate previously underutilized blood vessels. Toe touches add bursts of blood flow, further enhancing circulation. To perform, find a safe, clear space of at least 20 feet. Walk backwards slowly, landing on your toes before rolling to your heels, then pause every 20 steps for 5 toe touches. Maintain a steady breathing rhythm. Inhale for 2 steps, exhale for 2 steps, and take a deep breath per toe touch. Repeat for 5 rounds. This exercise can dramatically improve blood flow, reduce arterial stiffness, enhance balance, and strengthen rarely used muscles. Gradually increase walking speed and add hand movements or light weights as tolerance improves. Even patients who previously struggled with mobility have regained stability and leg strength within a few weeks of consistent practice. Research has shown backward walking can increase energy expenditure by 30% compared to forward walking, further enhancing vascular function and oxygen delivery. Integrating the exercise's consistency is key to maximizing the benefits of these exercises. Performing all 5 exercises daily creates a synergistic effect, addressing circulation from multiple angles, improving oxygen delivery, reducing swelling, and enhancing muscle strength. Begin with the lower intensity exercises and gradually progress to the more advanced movements as comfort and endurance improve. Most people notice initial improvements within a week, such as warmer feet, reduced heaviness, and increased energy in the legs. Over time, circulation strengthens, balance improves, and mobility is restored, creating a profound positive impact on quality of life. Understanding the science behind it. Each exercise targets specific physiological mechanisms. Calf raises stimulate the calf muscle pump, creating upward blood flow against gravity. Seated leg extensions with ankle flexion counteract venous pooling and strengthen supporting muscles. Wall sits with calf pulses enhance isometric contractions, forcing blood through capillaries. Supine cycling leverages hydrostatic pressure reduction, increasing nitric oxide production to widen arteries. Backward walking introduces novel muscle activation, enhancing neural control of blood vessels. Together, these movements address both mechanical and neurological factors contributing to poor circulation. Evidence from universities, clinics, and vascular research consistently shows measurable improvements in blood flow, oxygen delivery, and reduction of symptoms like swelling, numbness, and cramps. Benefits beyond circulation. Improved circulation doesn't just enhance leg health, it impacts overall well-being. Patients often experience increased energy, improved mood, better balance, reduced pain, and enhanced cognitive focus. Strengthening leg muscles contributes to independence, making daily activities safer and easier. Regular practice supports cardiovascular health, reduces risk of venous complications, and can alleviate long-standing discomforts such as restless legs or chronic swelling. These exercises also promote confidence as patients regain the ability to move freely without fear of fatigue or instability. Tips for safe practice. Safety and proper technique are critical, especially for adults over 60. Ensure exercises are performed on stable surfaces with adequate support. Start slowly and gradually increase duration, resistance, and complexity. Listen to your body, resting when needed, and avoid any movements that cause sharp pain. Using modifications or props like resistance bands, small steps, or walls for balance can help prevent injury while still providing substantial circulation benefits. Performing exercises consistently, twice daily, encourages long-term vascular health while building strength and endurance. Long-term impact. When performed consistently, these 5 exercises have the potential to transform leg health, restore independence, and significantly enhance quality of life. Blood flow improves, muscles strengthen, swelling decreases, and overall mobility returns. Patients often report a sense of renewed vitality, reduced fatigue, and greater confidence in walking, climbing stairs, or performing daily tasks. Even subtle improvements, such as warmer feet or less heaviness in the legs, can create meaningful differences in comfort and well-being. Over time, these exercises foster resilience, improve circulation efficiency, and contribute to a longer, healthier, more active life. Conclusion. Poor circulation can quietly undermine strength, balance, and independence, but it doesn't have to. With targeted, research-backed exercises, standing heel raises, seated leg extensions with ankle flexion, wall sits with calf pulses, supine leg cycling with resistance intervals, and backward walking with toe touches, it is possible to restore blood flow, strengthen muscles, and reclaim energy and mobility. By integrating these exercises into daily life, adults over 60 can experience dramatic improvements in leg health, reduced swelling, and enhanced overall vitality. With patience, consistency, and proper technique, circulation can be revitalized and the legs can once again feel strong, capable, and alive.